Hello, my name is Colleen Hughes, and I'm going to be going through the elbow evaluation. First, we're going to begin by clearing the cervical spine. I'm going to have you look up to the ceiling for me. Back down. Does that alter or change your pain?
No.
Have you look over your right shoulder, then over your left. Back to the nose. Does that alter or change your pain?
No.
I'm going to have you bring your ear to your side. Other side. Does that alter or change your pain?
No.
And then lastly, bring your chin to your chest. And then back up. Does that alter or change your pain?
No.
Next, we're going to do active shoulder abduction, just to rule out any shoulder issues. Going to bring your arms all the way up, back down. Does that alter or change your pain?
No.
Then we are going to be going through elbow active range of motion. So I'm going to have you flex, bring your arms up, and then elbows down, extend, back up again. Then have you bring your wrists like this, pronate, supinate, back and forth, both sides. And then lastly, wrist flexion and extension. Does that alter or change your pain?
No.
Now we are going to be going through passive range of motion of the elbow. So we're going to do passive flexion, low overpressure, passive extension with overpressure, pronation with overpressure, supination with overpressure, and then wrist flexion and extension. Does that alter or change your pain?
No.
And then this side, flexion, extension, pronation, supination, wrist extension, and then wrist flexion. Does that alter or change your pain at all?
No.
And then we are going to go through isometric resistance of the elbow. So first we're going to begin with elbow flexion. All right, hold strong, don't let me move you. Elbow extension, hold strong, don't let me move you. Now wrist flexion extension, so hold here, don't let me move you, wrist extension, and bring your arm down. Hold strong, don't let me move you for wrist flexion. Ulnar and radial deviation. So I'm going to have you ulnarly deviate here, hold strong, don't let me move you, and then have you radially deviate, hold strong, don't let me move you. I'm going to resist pronation and supination, so you're going to have them grab your hands like this. We're going to do a handshake, and we are going to first resist pronation, and then supination. And then you would test the isometric resistance bilaterally. The first structure we're going to look at is the distal biceps tendon. So first we're going to do isometric elbow flexion. Hold strong, don't let me move you. And then we are going to do the hook test, where we hook underneath that biceps tendon to see for a rupture. And then we are going to palpate that tendon as well. Next, we're looking at the distal triceps tendon, which we will do isometric elbow extension. Hold strong, don't let me move you. And then have you turn around. We're going to palpate that distal tendon right there. Now we are going to be looking for medial epicondylitis, and first we will do isometric wrist flexion. We're gonna have you bring your hand down, hold strong, don't let me move you. And then next we're going to do the manual muscle testing for flexor carpi ulnaris and flexor carpi radialis. I'm gonna have you make a fist. And for flexor carpi ulnaris, they're going to flex their wrist and ulnarly deviate. And now here, hold strong, don't let me move you. And then for flexor carpi radialis, they're going to flex their wrist and radially deviate this way, and then hold strong, don't let me move you. And then lastly, you're going to palpate the medial epicondyle right there. And then next, we're going to test for lateral epicondylitis, which we do isometric wrist extension. You're going to have your hand up, hold strong, don't let me move you. And then next, we're going to have you sit down for the manual muscle testing. First, we're going to do extensor carpi ulnaris, where you're going to have you make a fist. They're going to extend their wrists, ulnarly deviate, and then hold strong, don't let me move you. For extensor carpi radialis longus, their elbow is going to be fully extended. Have you make a fist again. Have them extend and radially deviate. Hold strong, don't let me move you. And then for extensor carpi radialis brevis, your elbows flex to 90. We're going to extend and radially deviate. Hold strong, don't let me move you again. And then for extensor digitorum, extend their fingers out. Hold strong, don't let me move you. And then lastly, we're going to palpate the lateral epicondyle. So now we're going to be testing the ulnar collateral ligament of the elbow. So first we're going to do the valgus stress test. So here you have the patient flex their elbow to 30 degrees, and you're going to palpate the medial epicondyle and apply a valgus force while abducting the hand like that. And then we're going to do the moving valgus stress test where you abduct your shoulder to 90 degrees. We're going to stabilize right here, applying a valgus force and extending the elbow. And then lastly, we're going to do the posterior lateral rotary instability test for the elbow. So we're going to have you lay down on your back. We're going to take the elbow and have them extend all the way out here. We're going to slightly supinate their hand, and as we bring them through it, we're going to continually supinate, applying a valgus torque and flex their elbow. And then I'll have you stand back up, and we're going to palpate the UCL of the elbow, which is right here. So next we are now going to test for the radiocollateral ligament by doing the varus stress test. So once again, we are going to have their arm flex to 30 degrees and apply a varus force while adducting the hand distally. And then we are going to palpate that radiocollateral ligament. Next, we are going to test for the ulnar nerve in the ulnar nerve compression. So first we can do the Tinel sign, where you can take a reflex hammer and you just tap over that cubital tunnel, and that would reproduce symptoms down their hand by the ulnar nerve with tingling. Do the stolen paper test, where you take the paper, have the patient put this in between their 4th and 5th digit, have them bring their fingers together, and then you try to pull it out. It should be difficult. Thank you.